Hello there. I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Today's show will be about ALS, or amyotrophic lateral sclerosis, commonly known as Lou Gehrig's disease. In addition to the baseball legend, physicist Stephen Hawking and British actor David Niven were also diagnosed with ALS. May is also ALS Awareness Month, when multiple organizations and communities spread awareness about this rare neurodegenerative disease. Some of you may also remember the Ice Bucket Challenge back in 2014 that raised millions of dollars worldwide for ALS research. But there are other ways that you can make a difference. Stay tuned. So let's start off with the basics. What exactly is ALS? Amyotrophic lateral sclerosis, or ALS, is a rare, progressive neuromuscular disease that affects nerve cells in the brain and spinal cord. These nerve cells, or motor neurons, are responsible for controlling voluntary muscle movement like walking, talking, and chewing. When the motor neurons can no longer send signals to the muscles begin to waste away or atrophy, which leads to muscle weakness. Amyotrophic is Greek for no muscle nourishment. As a result, muscles waste away or atrophy, as I mentioned. Progressive, in this case, means that symptoms get worse over time. Note that ALS is a purely motor disease. That is, it impairs movement. It does not cause cognitive impairment such as problems with thinking or memory, nor does it impair the five senses like hearing and sight, vision, or bowel, bladder, or sexual function. So what causes ALS? Scientists actually don't know. It's still a mysterious illness. 9 out of 10 cases have absolutely no identifying cause. No genetic history, no dietary or environmental risk factors, nothing. That said, research suggests that genetics play a role in about 5% of cases where mutations were found in the SOD1 or superoxide dismutase gene. Environmental factors may also increase ALS risk. For example, toxin exposure during war or strenuous activity may explain why some veterans and athletes are at increased risk for developing ALS, according to researchers at Johns Hopkins University. So, who gets ALS? According to the National Institute of Neurological Disorders and Stroke, people from all races and ethnicities can get ALS. While people of any age can get ALS, it mostly strikes between roughly ages 50 to 70. Men are slightly more likely than women to get ALS, but with age, the rates even out. Nearly 50,000 people in the US and 5,000 new cases are diagnosed each year. Interestingly, military veterans are 1.5 to 2 times more likely to develop ALS. Reasons are unknown, but risk factors include exposure to lead, pesticides, and other environmental toxins, as I mentioned earlier. So, what are the symptoms of ALS? Early on, a patient may experience muscle cramps, muscle twitches in the tongue, arm, shoulder, or leg, muscle spasticity or stiff and tight muscles, muscle weakness in the arms, legs, neck, or diaphragm, and difficulty chewing or swallowing. As the disease progresses, muscle weakness and atrophy spread to other parts of the body, leading to difficulty swallowing or dysphagia, difficulty breathing or dyspnea, speech problems or dysarthria, and movement problems or paralysis. So how is ALS diagnosed? No single test provides a definitive diagnosis. In addition to a complete history and physical exam, your doctor may order blood tests, a muscle or nerve biopsy, X-ray and MRI, a nerve conduction study to measure electrical activity of the nerves and muscle response, and electromyography or EMG, which detects electrical activity of the muscle fibers. How is ALS treated? There's currently no cure for ALS, nor can available treatments reverse damage to motor neurons. But several treatment modalities can provide symptomatic relief and help patients feel more comfortable. There are 2 FDA-approved medications. Riluzole is a pill that can reduce damage to motor neurons and may extend survival by a few months. Edaravone is an intravenous medication that can slow functional decline in people with ALS. Other treatment options include exercise, nutritional counseling, physical, occupational, respiratory, and speech therapies, heat or whirlpool therapy. Social workers, psychologists, home care, and hospice nurses are all important members of this interdisciplinary care team. Want to get involved? Here's your call to action. You can donate to, volunteer with, and learn more from visiting the ALS Association, ALS Action in Canada, Compassionate Care ALS, I Am ALS, and the Les Turner ALS Foundation. Well, that's all for today, and here's your joke of the day to start your week off right. How do bees get to school on Monday? They take the school buzz. Thank you so much for tuning in. I'll see you on Wednesday, 3 p.m. Eastern, when I'll be discussing mental health and women's health. Be sure to subscribe to my YouTube channel and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.